Welcome to this presentation by Abington School District School Psychologists. In this presentation, we will define what trauma is and how to identify trauma in our students, as well as the supports available in our school district. Trauma is an exceptional experience in which powerful and dangerous events overwhelm one's capacity to cope. Trauma can threaten the safety and security of an individual. It is important to note that trauma can occur on a spectrum, with a single incident, multiple traumas, or chronic and repeated trauma. Child trauma occurs more than we think. More than 2/3 of children reported at least one traumatic event by age 16. This slide presents different potential sources of trauma or adverse childhood experiences. Some of these include psychological, physical, or sexual abuse, community or school violence, natural disasters, experiencing or witnessing domestic violence, physical or sexual assault, neglect, serious accidents, or life-threatening illnesses. A study was done on adverse childhood experiences, also known as ACEs, and found that as the number of ACEs increases, so does the risk for negative health outcomes.
Keeping in mind that not every negative experience will lead to a trauma response, these are some of the factors that can increase the likelihood that a child will be traumatized by a negative event. These include proximity to a traumatic event, past exposure to trauma, current or past mental health problems or the presence of a disability, parental substance abuse or mental illness, limited social support or isolation from family stress or domestic violence, loss or fear of the loss of a loved one, community characteristics, developmental level, and poverty level.
The goal of learning about trauma is to be able to shift our thinking in how we understand the reactions or behaviors in children who have been traumatized. Trauma-informed care. First, recognize the presence of trauma symptoms. Acknowledge the role of trauma in a child's life. And create a culture that prioritizes safety, trust, choice, and collaboration.
With a trauma-informed care approach, we want to shift our thinking. So instead of observing a child's behavior or reactions and thinking or asking, "What is wrong with you?" we want to stop and think, "What has happened to you to cause these behaviors?" Extreme trauma impacts the brain. The part that is most impacted is the amygdala, which is the emotional center of our brain. It is our survival brain. When it is activated, we respond automatically by fight, flight, or freeze. Trauma can cause this part of the brain to become larger and react more quickly or to misfire more quickly, even in response to everyday normal situations. Other parts of the brain that are also impacted include the hippocampus, which is responsible for memory, self-regulation, language development, and other skills necessary for learning. This part of the brain is usually smaller in students who have experienced trauma. These are examples of how children may respond when their fight, flight, or freeze is activated in response to an event. Fight. They may act out or behave aggressively. Flight. They may withdraw or flee the classroom. Freeze. They may exhibit numbness or refuse to answer. These are just some of examples of how children may respond. There is hope, because not all children experience traumatic stress following a traumatic event. It looks different for each child. Children can and do recover from traumatic events, and parents and school staff play an important role in their recovery.
So how can you, the parent, help? First, you can assure your child that they are safe. Be patient. Some children will recover quickly while others recover more slowly. Reassure them that they do not need to feel guilty or bad about any feelings or thoughts. Explain that they are not responsible. Children often blame themselves for events that are completely out of their control. Other ways to help include helping your child identify and highlight their strengths, maintaining usual routines and providing consistency in their day-to-day, keeping a calm and neutral tone of voice, using positive reinforcement to increase positive behaviors, and teaching and modeling appropriate coping skills such as deep breathing, mindfulness, and relaxation exercises. Within the Abington School District, we partner with you as parents in supporting your children and our students. Our school-wide supports include trauma trainings for all staff, second step lessons that are done in the classrooms weekly, consultation with teachers to develop behavior support plans, and individual supports include individual behavior charts, check-in and check-out, mentoring program, small group counseling through Aldersgate, as well as group and individual counseling done by our counselors and school psychologists. And we also partner with Child and Family Focus Clinic, which provides individual counseling for students who need extra support. Additional community-based supports are available if students continue to demonstrate difficulties coping with trauma experiences, and you can ask your counselor or psychologist to learn more about them. These are some additional resources to learn more about childhood trauma. You can find them through NASP, the National Association of School Psychologists, as well as the National Child Traumatic Stress Initiative.